Hey guys, so I'll go ahead and start on the disaster day assignment. So the first question, if the hospital has a current supply of 5 ventilators available and 10 patients who require ventilator assistance, how will you determine which patient will be chosen to receive the ventilators? First and foremost, we could definitely see, is the patient a DNR or a DNI? We can look at the patient's quality of life, and we can determine which patient is most likely going to survive the longest after treatment. What would you decide for as a standardized policy on visitor restrictions? So I would implement no visitors because the virus is spreading so quickly and it's so contagious. So I would encourage friends and family to stay in contact with their loved ones through video calls and phone calls. And then, with the exceptions of pediatric patients who are under the age of 18, they could have one adult visitor with them, and any laboring mothers can have a support person with them. With those visitors, I would make sure that they are screened prior to entering the facility and making sure that they wear a mask at all times, making sure that they practice hand hygiene, making sure they practice safe distancing, just to help reduce that spread to healthcare workers, to patients, to other visitors that might be there as well. Number 3, how would you handle the situation with running out of necessary PPE equipment? So we could reuse goggles and disinfect them after each use. We could encourage hospital staff to use reusable cloth masks. We could determine which procedures require N95 masks and save those for those procedures and any alternatives to N95 masks. Number 4, how do you handle units being short-staffed? We could offer employees incentive pay. We can ask if any employees want to work extra shifts. We can staff employees from float pool, and charge nurses may have to take on patients to help lessen that workload. Number 5, how do you choose which units will be transitioned to the COVID-19 units? So we could transition the ICU for the more severe cases that require like intubation and all that, vents. We could transition the tele unit and making sure all those employees on those units get the proper training on how to don and doff PPE, how to dispose and disinfect items, how to properly administer aerosolized treatments, as well as how to safely obtain specimens. How do you handle ICU and PICU bed shortages? What areas in the hospital could be changed into temporary COVID-19 spaces? So we could have an ICU nurse and a doctor stay with the patient until the patient is able to be transferred, just to be certain that their condition doesn't decline, that it remains stable. As far as the temporary COVID-19 units, we could use the overflow units. We can combine units that have less patients and combine them in one unit and use one unit for COVID patients. And then we could also use PACU since there are no elective surgeries going on. So we could definitely utilize all those spaces as temporary COVID-19 units. How has the pandemic virus, COVID-19, affected your thoughts, feelings, and goals about becoming a nurse? It's definitely a crazy time to be in, especially since we are graduating in 2 weeks. There's so many changes occurring. Hospitals are changing how they run things. There's new information and updates every single day, which builds up a lot of fear and uncertainty. But with all the abundance and support, love, gratitude from millions and millions of people worldwide, definitely reminds me and takes me back to the reason why I want to be a nurse. And I know that together we will all get through this. We just have to keep staying safe, keep implementing the guidelines that are out there, practicing social distancing, and yeah,